right. Well, thank you all for joining us for the next session in the Media and Family track of the Within Summit. As a reminder, you can access all of your conference information and your sessions from the attendee dashboard, and all of the sessions this week are recorded and made available for attendees in that dashboard, so take a look. It's my pleasure today to introduce you to our speaker for this session, Mr. Ross Szabo. Ross is a keynote speaker, author, and award-winning mental health advocate with over 20 years of experience in suicide prevention and awareness for teens. And he is the wellness director at Geffen Academy at UCLA. His background and experience is super impressive. I'm sure you can hear more about it during the session. And with that, I'll hand it over to you, Ross. Take it away.
Thanks so much. It's really great to be here today. I'm looking forward to having a chance to talk to you about everything I do. Everything he said in that introduction is definitely correct. My full-time job right now is as the wellness director at Geffen Academy at UCLA. We have a program where we teach students in grades 6 through 12 about their mental health once a week, every single week as part of their education. It's a graduation requirement. So that's been a lot of fun to create and do. And then outside of that, I still speak and write and travel around the world talking about mental health. So what I'm going to do today is do a presentation that kind of mirrors what we teach young people, but also what's useful for us to think about as adults. None of us come into this world without some lived experience. I often joke with people that I didn't become a mental health advocate because life is perfect. And then one day I was like, I should tell everyone how perfect life is. There's a lot happening in our world. And when we think about the youth mental health crisis, it's also really important to think about what we are doing as adults and where we came from and how we influence the youth mental health crisis. So I'm going to bring up some slides here for the presentation. Do that now. All right, so the title of my book and the title of a lot of my talks I give is called Behind Happy Faces. And it's really just become even more poetic as time has gone on. One of the biggest challenges I think that people face at every age is how do we be vulnerable? How do we share what we're actually going through? How do we talk about what's happening in our lives? I think one of the biggest challenges I've seen in the 20 years that I've been a mental health advocate is whenever you say the words mental health, people have different ideas of what those words mean. So a lot of people, when they hear the words mental health, tend to think of these images. They think of celebrity breakdowns, they think of mass murders, they think of school shootings, they think of people looking angry, sad, lonely, scared. And so I think one of the most important things we can do in the mental health space is come up with an actual clear definition of what mental health is. Mental health is not having a problem. Mental health is not having a diagnosis. Mental health is not having an issue. As a lot of you know, mental health is how you address the challenges in your life. What I have seen on a lot of campuses I've worked on and a lot of national campaigns I've run is that we have a lot of buzzwords around mental health. One of them is we'd like to say that mental health is like physical health. And obviously I completely agree, but we actually need to teach that and we need to treat it that way. So one of the ways that I treat this and teach it in my own classroom and with my family and friends is I ask people like, hey, when you think about physical health, are you preventative or are you reactive? And for a lot of people, if they think about physical health, they're preventative. They go to the doctor, they watch what they eat, they take care of themselves. They obviously have reactive moments where they get sick and they have to go see someone. But when I ask them about their mental health, are you preventative, are you reactive? A lot of them mainly say the reactive. They wait until something's wrong and then they try to address it. And so I think that's really important as just a conversation starter is how do we define mental health and what does it mean? And then I think for everyone, it's really important to emphasize that mental health isn't about being perfect. You know, with the teens that I work with, they get all these messages that they have to sleep 8 hours a day and have good stress and always have good coping mechanisms and everything else. And what I try to emphasize with them is like, it's not about being perfect. It's about knowing what skill you need to use and when to use it, much like physical health. So I always really begin these presentations by thinking about like, hey, how do we move past the buzzwords of mental health as like physical health and actually teach that? We don't really need to go too much into statistics here about how many people are struggling and what's happening to them. I think we're all pretty clear on those statistics. I think one of the downsides of mental health awareness, and one thing that I think is really important to be proactive about, is when we do awareness campaigns where we go out and tell people how many people experience mental health disorders, or how many people experience suicide, suicidal thoughts, or how many people die by suicide, or how many people have eating disorders, that we really do need to move past awareness and start teaching skills. The one unintended effect of mental health awareness is we kind of go out and tell everyone how messed up they are, and then we don't teach them what to do about it. We tell them to go talk to a counselor or talk to a professional. It's really important to start building mental health skills, because we would never do this with a physical health campaign. We would never sit people in a room and be like, hey, you all have cancer and diabetes and heart problems, and you're all going to die. And then when they were like, I don't want to die, just be like, well, go talk to a doctor. I was just here to tell you you're going to die. I don't have any information for you. If you think about the most successful physical health campaigns, they used a public health approach where they told people what the problems were, but then they taught them what they can do about it, how to eat healthy, how to exercise, how to know your family history. And so it's time to do the same thing with mental health. And that's really I'm going to do in this presentation today. Through some of the biggest challenges that I see in our society, mainly around mental health literacy and how we can improve mental health literacy. I'm going to share with you my personal story. As I alluded to earlier, I didn't have a perfect life, but the main reason I share my personal story is for you to think about your own experience, the experience you've had as an adult, the experiences of the people you're working with, and then, I'll talk a little bit about coping mechanisms and why the development of coping mechanisms are so critical to people of every age. I always like to begin this presentation with this question. So now that mental health awareness is such a huge focus in our society, we have more people seeking help, but it's still around 50% of people who don't seek help. When I ask this question to people of all ages, I get similar answers in every age group. So there's a lot of shame, there's a lot of embarrassment, there's still an element of feeling like it's a sign of weakness if you seek help. One of the biggest answers that's changed, I think, over the past decade has been people saying like they don't want to be a burden to other people. So they're not seeking help because they don't want to burden their friends or family or bring people down. There's a lot of trust issues. People don't know who they can trust, and especially for adults, if they can trust somebody in the workplace or what they can do. I think that's a big topic. But the reason I start with this question is because this is often one of the biggest barriers preventing people not just from seeking help, but also being compliant. When I was 16 and I was diagnosed with bipolar disorder, I wasn't compliant with my treatment because I felt stupid, embarrassed, ashamed, weak. I felt like I should be able to suck my problems up on my own. I felt like they should just go away. And I never really discussed what was happening. And I always share with people that, yeah, it's important to have a definition of mental health, but once you do, this is step A. It's not treatment. It's not therapy. It's asking people why they don't why they don't talk about mental health, why they don't seek help, and then helping them be more comfortable with that. One of the easiest ways to do this is to compare physical health to mental health, and is to help people see that. But this really is a good starting point. If you want to make a difference in your friends or family relationships, you have to ask this question and then help people be more comfortable, because their lack of comfort is often a giant barrier to them being compliant. What we have found and what you have found as professionals is people don't often have a vocabulary for their mental health. So you can ask somebody like, hey, how's your mental health? And you get 1 of 3 answers. It's good, it's bad, or it's fine. And fine is really just a way of saying, I don't want to talk about it. So I think one of the next frontiers here is really mental health literacy, how we talk about mental health, how we engage with mental health. We know from decades of research with physical health literacy that if people can name their body parts, if people can identify when something's wrong, they seek help a lot sooner. So we need to do the same thing with mental health. Again, moving past the buzzwords, but giving actual skills. So one thing we need to do is teach that there are different categories for mental health challenges. If you think about physical health, we know the different categories for physical health challenges. People know the difference between a sprained ankle and a broken leg. They know the difference between having a cold versus having a flu, unless of course you're male, because when I have a cold, I don't know, could be pretty serious. I won't know if it's more serious until I get support and love and attention. We know the difference between having cancer and having diabetes. So we have different categories for physical health. We need to do the same thing with mental health. We need to teach that everyday challenges are things that everyone can experience on a daily basis. Environmental factors refer to the home you grew up in, the school you went to, the way you're raised. Significant events are experiences with loss, change, or rejection that impact a person's life. Mental health disorders are diagnosable disorders from a mental health professional, and developmental disabilities are disabilities. The reason we need to do this is because what's currently happening in society is people of every age think stress is the same thing as having an anxiety disorder. It's not. They think going through a divorce is the same thing as having clinical depression. It's not. And so with different categories, people can identify where they are and then assess what they need. The next thing we really need to change, though, is the mental health spectrum that a lot of people use in today's society. The mental health spectrum that most people use today is kind of like this one. On one side, you have people who are sane or don't have mental health disorders. In the middle, you have people with mild mental health disorders. And then on the far end, you have people with severe mental health disorders. I've seen this spectrum presented differently. Now there's like a Maslow's hierarchy, like a little, triangle. And at the bottom is people who don't have stress. And then up from that is mild mental health challenges. And then at the end of that is severe mental health disorders. Whatever way you're saying this, or a lot of people are saying this, it all sucks. And it sucks for two big reasons. Number one, I have bipolar disorder. I'm also sane at the exact same time. So if I'm on two places, opposite places of the exact same spectrum, it's not working. The other damaging thing that the spectrum promotes is that these people need help and these people don't. And we don't do that with physical health. Like with physical health, you're never going to get advice that's like, hey, you don't need to eat healthily until you get diabetes, or like you don't need to exercise until you get cancer. If you think about physical health, the entire way we frame it and promote it is preventative and proactive. So we need to do the same thing with mental health. And one of the ways to do that with mental health is to realize that when we talk about physical health and a physical health spectrum, we don't take all physical health calamities and try and jam them into one spectrum. We don't have a physical health spectrum that's like, well, a torn ACL is like diabetes, but it's also like cancer, but we also need to put like COVID in here. Like with physical health, we choose one physical health issue and we put it into a level of functionality. For some reason with mental health, we try to jam it all into one spectrum. It's not working. So we need to change this spectrum to be more like this. On one side of the spectrum, you have people who don't have stressors. These are people who don't have to think about their mental health much. They get to walk around the world, not really thinking about their mental health, not considering different things. These are the people that I hate most in life, but they exist, so they get a place on the spectrum. If you think about it, there are people who don't have to exercise or eat healthy, and they're naturally thin and strong. I hate them too, but they also exist. So they would get a place on a physical health spectrum. Next to that is difficult to balance. Difficult to balance could be someone who's aware that they're not sleeping enough, aware that they're stressed out, aware that they need to do something about it, but they're not using help actively. Using help to balance could be someone who's in therapy or on medication, but it could also just be someone who every day knows that they need to listen to music, talk to a friend, exercise, or do something, use something to help their mental health. You don't need to have a mental health disorder to use help to balance your mental health. Needing constant assistance to balance, I don't know why that's outside of the box. That's kind of funny. Could be someone who's in a treatment program, but it could also just be someone who all of you have seen before. So some point in your life, someone you love or someone you cared about went through something really severe, and you decided you weren't going to let that person be alone. So you decided you were going to stay at their house. You were going to cook for them. You were going to sleep there. You were going to do everything you could for a couple days or a couple weeks, depending on how much they needed it. And then not able to balance could be someone who is suicidal, but it could also just be someone who went through something so severe that no matter what they try, they can't balance their mental health. I think the most difficult thing I've ever gone through for my mental health to this day is when my dad died. 5 years ago, my dad passed away completely unexpectedly. And I got that phone call and went from someone being someone who uses help to balance to someone who was not able to balance my mental health for really 4 or 5 months because the grief of losing my dad was that severe. And I share that with you because all of us are on this mental health spectrum, and our place on this mental health spectrum can change within minutes. That's the thing that's different about creating a mental health spectrum that is similar to a physical health spectrum. You would choose one mental health issue and then put it in the spectrum, as opposed to trying to jam all mental health issues in the spectrum. And then you put using help to balance in the middle, because that's where it is for physical health. When all of you see someone exercising or running or doing something proactive, none of you think, what a freak, what a weirdo. You think, oh, wow, I should probably hit the gym too. We need to get to a place with mental health where that is as normalized, where using help is encouraged and thought of like, wow, that's good for them. I need to do a similar thing. The other thing we need to do with mental health literacy is think about how we talk about stress. So a lot of times we look at young people and we say they're having a competition to see who's more stressed out. And the way that sounds in a school is like they're competing over who has more tests or papers or extracurricular activities or more responsibilities. But we do this as adults too. As adults, we tend to have conversations around who's busier. So one person will share like, oh, I'm so busy. I have all these things I'm doing, all these things I'm trying to take care of. And then the next person tries to kind of out busy them and be busier. And I think it's really important for people of every age to understand if you're having a competition to see who's more stressed out, it truly is a competition that nobody wins. You don't win a car, you don't win ice cream. You win by being like the most burned out person and that's not a victory. So what this comes down to, again, from the mental health literacy perspective, is that there's a huge difference between good stress and bad stress. Good stress motivates you, activates your fight or flight mechanism for a really short time, helps you get things done. Bad stress debilitates you, activates your fight or flight mechanism for a really long time, and tends to shut you down. It's body aches, it's insomnia, it's headaches, it's changes in appetite. It's all of those things that people don't want. The challenge is when I say just the word stress to all of you listening to this, how many of you immediately think of good stress? How many of you immediately think of bad stress? And that's the actual challenge, because longitudinal studies show that when people categorize all stress as being bad, they often have more physical and mental health disorders. They die about 5 years before life expectancy, and they have a much more difficult life. We need to start not just teaching that good stress exists, but also modeling it for younger generations and showing that, like, yeah, you can be really busy, you can be really successful, and you can use good stress to make that happen. And I think that's a really important distinction, especially for mental health literacy, but also for the health of all people of every age. As we dive deeper into mental health literacy, it's really important for people to understand that there's a big difference between feeling nervous and having an anxiety disorder. I know, again, we love to like blame kids and say kids don't get it. I can't tell you how many adults I talk to who don't understand this. They think that, being nervous is equivalent with like low-level anxiety disorder. And so just explaining to people that like nervousness lasts for a short amount of time and it goes away. It's normal to have butterflies in your stomach. It's normal to feel nervous. Whereas an anxiety disorder is that nervousness times 900 million, where it's a feeling of anxiety that builds on itself until a lot of people do end in a panic attack. You can tell someone who's nervous to calm down. Someone who has an anxiety disorder, the opposite of that is being able to see reality. Same thing for feeling depressed versus having clinical depression. A lot of people I talk to, especially my age, are like, I went through a divorce and I didn't need antidepressants. And I'm kind of confused by that, where I'm like, okay, but like, unless you have a history of depression in your family or in yourself, or have had a bout of depression, like, you shouldn't need antidepressants. So just normalizing for people that it's okay to feel depressed and sad and upset. It's okay to have these emotions. And the opposite of feeling depressed is happiness. But depression is a much different beast. It's, you stop doing things you enjoy, you stop taking care of yourself, you lose motivation. You may have uncontrollable thoughts of death or suicide. Those symptoms may last for weeks or months at a time. And then the opposite of clinical depression is not happiness, it's vitality. You can do a similar thing here for a lot of other issues. There's a big difference between not liking your body versus having an eating disorder. There's a big difference between having a normal thought about death and actually having a plan to kill yourself. So these kinds of mental health literacy elements are really important because it gives people a baseline knowledge of vocabulary and how to talk about things. What I'm going to focus on for really the bulk of the next part of my talk is how a lot of adult patterns start in adolescence. So I often joke with people that sometimes being an adult is just undoing adolescence or reliving adolescence, depending on your self-awareness. There's this a fascinating neuroscience study called Why You Never Really Leave High School. And what the study showed is that people's first experiences with loss, change, and rejection happen during the second largest period of brain growth. So the second largest period of brain growth is between the ages of 12 to 25. And what happens during that time period really does matter. The coping mechanisms we develop, the internal voice we develop, the identities that we develop can last forever. And so what the study, Why You Never Really Leave High School, showed was that even in adulthood, for people in their 40s, 50s, and 60s, they were reliving their high school identities in the workplace. So the person who felt like they were cool and fit in, felt like they were cool and fit in. The person who felt like the outcast was the outcast. The person who was the introvert was the introvert. All of the same kind of identity markers stayed true into adulthood. And so what I'm going to talk to you about today is my experiences with my mental health in adolescence and how they still affect me as an adult today. And I'm doing this for two reasons. One, you can think about the adolescents you deal with in your life and you work with in your life. But two, you can think about yourself and your own journey and where your strengths and weaknesses developed from in your own adolescent development, because we all went through it, we all remember it. So here's a list of my current strengths and weaknesses. My strengths are that I can accomplish many tasks in a short amount of time. So as I mentioned earlier, I do run a giant wellness program at a school. I also run my own company that creates mental health curriculum, and I speak and write around the country. So I do a lot of different tasks, and that's one of my strengths. I have a high amount of energy for creation. So I really like creating new things and trying to do different things. I'm detailed in organization and structure, and I do a lot to connect the dots to make major change happen within existing systems. My weaknesses are that I can frequently disconnect emotionally. I'm working on taking more time to relax or recharge. This one has actually improved a little bit over the last year. I can sometimes struggle to live in the moment and just start thinking about everything for the future. And I can often overlook smaller emotions necessary for growth. So those are my strengths and weaknesses. Now I'm going to shift to telling you my personal story and how these things actually evolve. So I have a really interesting beginning to my personal story. I live in LA now, obviously, but I didn't grow up in LA. I actually grew up in Pennsylvania. That's not interesting. What is interesting is I was actually born in Bethlehem and raised in Nazareth, Pennsylvania. If you're not familiar with my home state, an hour north of Philadelphia are two towns, Bethlehem and Nazareth. The deal is if you live in Nazareth, it's a really small town. It's like 2,000 people. There's no hospital in Nazareth. So if you're pregnant and you live in Nazareth, you actually have to go to Bethlehem, where there is a hospital, and have your child, and then flee back to Nazareth. I'm not sure how my mom got back. Not on the map is a town called Egypt. So realistically, you could be born in Bethlehem, raised in Nazareth, and then move to Egypt if the political circumstances in Nazareth were threatening. You could go there. Pennsylvania has a lot of really weird town names. On one road an hour south of Nazareth, you can drive through Intercourse, Middlesex, Virginville, and then the town next to Virginville is Blue Ball, Pennsylvania. I often joke with people that you might want to drive that road reverse. I don't know. It's up to you. It's up to what you're into. So I'm sharing this with you and you're like, I thought this was a mental health presentation. I'd like to point out that this is where my mental health issues started. I would like to blame the people who named these towns. I feel like they could have done a better job. It might have helped I don't know. We'll never know. Any story with mental health starts with a photo of a family. This is a really amazing early 1980s photo of my family. There's a lot happening in this photo. For example, my parents had an actual conversation and they were like, hey, what should we wear for the first family photo? And they were like, I know. How about those matching track jumpsuits with turtlenecks? In this photo, I am the baby in yellow being held by my dad. I have two older brothers. My oldest brother is 7 years older than me. My middle brother is 2.5 years older than me. But what I love about family photos is all of you can look at this photo and you can project your own emotions into it. But you don't actually know these people. Like, as you look at this photo, you would never know that my dad was raised by a classic 1950s alcoholic father, that my dad was never hugged once, that he was never told he was loved, that he never had a birthday party, and that he was often a survivor of extreme physical violence, much like his mom, his brother, and his sister. As you look at this photo, you never know that my mom grew up in a home with two parents who were alcoholics, a mom who had a severe anxiety disorder. Sometimes my mom came home to baking and music and cookies. Sometimes my mom came home to a really dark place. When these two people got together, they decided they were going to raise us differently. So my dad, who had ended up having 3 boys, decided he was going to tell us he loved us every day. He was going to hug us every day. He was going to show up for us in every way he could. I can't remember a single sporting event from the time I started playing at age 5 until I stopped playing where my dad wasn't on the sidelines. I can't remember a single speaking event when I started speaking nationally that was within 350 miles of him that he wasn't in the front row. My mom did everything she could to make sure that our home life was stable, that it wasn't filled with emotional abuse and psychological abuse and the roller coaster of unpredictability that she grew up with. And both of them worked really hard to make sure that we were raised 100% different from the way they were raised. But the one thing that both of these people could never change is that on both sides of our family, we have severe mental health disorders. We have clinical depression, anxiety disorders, bipolar disorder, and addiction. I make a lot of jokes about Bethlehem, Pennsylvania, but it really was one of the epicenters of the Industrial Revolution. For a good 3 or 4 decades, Bethlehem Steel was the largest steel manufacturer in the world. Almost all the buildings that were built in New York City in the 1900s came from Bethlehem, Pennsylvania. Almost all the steel for the Golden Gate Bridge came from Bethlehem, Pennsylvania. 75% of the cement for the Panama Canal came from the town next to Bethlehem, Pennsylvania. It was a really blue-collar town where people went to the factory and then they either went to the bar or they went home. People just sucked things up. So while my parents were well-meaning and raised us completely differently from the way they were raised, they really couldn't change the outcome of the mental health disorders that my family was going to experience. And my life and my family's life changed significantly when I turned 11. This is me at 11. What we're doing in this photo is dropping my oldest brother off for his sophomore year at the University of Pennsylvania. My oldest brother is really book smart. I want to emphasize books because outside of books, there's not a lot happens for him. But he is so book smart that he graduated high school when he was 16, and he went to the University of Pennsylvania to major in physics. Got through his freshman year, everything was great. In this photo, we are dropping him off for his sophomore year at the University of Pennsylvania. We dropped him off at the end of August, like everyone did. And then at the end of October, my dad got a call from the University of Pennsylvania Hospital saying, your son has been determined to be a threat to himself and others. We've hospitalized him against his will. We hope that you can come down here immediately. My oldest brother has bipolar disorder. What happened was he hadn't slept for about 8 days. He was walking around campus trying to teach classes. He was singing loudly in stairwells and just disrupting campus. And so the counseling center met with him, assessed him, and put him on a 5150 at the University of Pennsylvania psychiatric ward. My family is actually extremely fortunate that that happened, because had someone called my dad and said, hey, we don't think your son's doing well, he needs mental health treatment, can you get it for him? My dad would have said no. The way my dad grew up, the way he went through his life, at that time he would have said no. there were a couple of things that benefited my oldest brother at this time. One, he was diagnosed in his very first outbreak, which is, as you know, really, really helpful for success rates. Number two, my dad was just an insurance agent for Prudential my entire life. But at the time, Prudential was offering mental health treatment, the same as physical health treatment for their employees. And number three, my brother accepted his diagnosis and didn't mess with his treatment. So he never drank, he never did drugs, he never tried to go off his medication or anything like that. And as all of you know, if somebody does that, the recipe for success or chance of success is much higher. So my brother took a year off from Penn. He was in a psychiatric ward for about 3 or 4 months. He went back to Penn. He was able to graduate with a degree in physics. He's now has his doctorate in astrophysics and is a professor out here at a college in California. So my brother's story is not my story, but it was really successful. My story is a lot different. I visited my oldest brother in the psychiatric ward in November that year. 2 months later, my grandmother died. 10 months after that, my best friend was killed. And 2 months after that, my grandfather died. So between the ages of 11 and 12, this little guy went through a lot of loss, a lot of trauma, a lot of different issues. And this is when my emotional regulation and my coping mechanisms began. What I learned at 11 and 12 was I wasn't really good about philosophizing about life and death, but I was good at making people laugh. So I went to all the hospital visits, all the family visits, everything outside of this, and I did everything I could to make people laugh. But I never talked about my own feelings. I never talked about my own emotions. And then around age 12, I started drinking alcohol. And I didn't drink every day, obviously. I drank probably 2 to 4 times a month. But I noticed that when I drank, I felt a lot more numb, and feeling numb felt better than everything else I was going through. And so I share this with you because we know that emotional regulation starts at this time for the people we treat. It's also really important to think about how we started regulating our own emotions, what our experiences with loss, change, and rejection were as adults, because this really is the beginning of the weaknesses section of my experience as an adult. By the time I turned 16, it's okay to laugh at this photo. Who thought this kid would have trouble adjusting to high school? Probably a lot of people, based on his clothing and his missing teeth. I put this photo up there for perspective, but at 16, I was diagnosed with bipolar disorder. And the most damaging thing about me getting diagnosed with bipolar disorder was not that the disorder itself, it was 2 things. One, at 16, I've now been hiding my emotions for 5 years. And I learned to drink alcohol before I learned to talk about my feelings. So even though I got this diagnosis, and even though I had access to help, I kept hiding my feelings and I kept drinking. When I went into my senior year of high school, I went into a really deep state of depression, which culminated in January of my senior year with me attempting to take my own life. When I did this, I wasn't on anyone's radar. I was president of my class for 2 years. I was a varsity basketball player. I was involved in every extracurricular activity possible. I had a perfect college resume, a super high GPA. And on the inside, I was dealing with crippling depression. But again, I had become an expert at hiding my emotions and continuing to drink. So when depression kicked in for me at the start of my senior year, I just thought the loneliness would go away. And then in November, when I started having uncontrollable thoughts of death and suicide, I really thought one day I'd wake up and I'd want to live again. And unfortunately, that day didn't come. On January 5th of my senior year, I was hospitalized for attempting to take my own life. And luckily, I was I was hospitalized and I stayed in the hospital for about 2 weeks and was able to find a way to come back and finish high school. I think a lot of times when people are hospitalized, it really is just an intervention. It really is just to get them back into society. I got back and was functional, but I was by no means healthy. When I got out of the hospital, I went through a lot of bullying episodes where people just started calling me a psycho and a crazy kid. And so by the time my college acceptance letters came in, I wanted to just get as far away from Nazareth, Pennsylvania as I could. I went to American University for my freshman year of college. I was there for about 2 months until I had a severe relapse with bipolar disorder and came home. I was hospitalized again. And then it was just a struggle for me for the next 4 years, really, as I battled extreme substance use issues and poor mental health. Eventually, I returned to American University at age 22, 4 years after my original freshman year. This is a really great photo of me. From the outside, again, everything looks pretty normal here, aside from the frosted tips. But don't hate on the frosted tips. It was, it was 2000, so it was really cool. I like this photo a lot because it is me moving back in 4 years after my original freshman year. So I'm 22 in this photo. And again, on the outside, everything looked great. I had a huge internship in DC. I had a really high GPA. I was giving school tours. On the outside, again, everything looked amazing. But I was much closer to death in this photo than I was when I actually tried to kill myself. Because at this age in my life, I was drinking more than I ever had. My tolerance went up and my self-hatred was immense. There are few things that are more dangerous than a human being who hates themselves. So I hated myself immensely at age 22, and I really didn't care what happened to me. I drove drunk all the time. I had unprotected sex. I did a lot of drugs because I really didn't care if I died. And so I went through a phase here in this kind of first semester back of my, third, fourth attempt at college, where I was drinking to the point where I just didn't care if I died. And so one night, kind of early December of that first semester back, I pre-gamed with about 13 shots of vodka in an hour. And then I went out, more shots, more beer. I passed out that night around 2 a.m. When I woke up the next day and looked outside, my clock said 12, but when I looked outside, it was dark. I'd been passed out for about 22 hours. And this wasn't uncommon for me. I used to binge drink so much that I'd pass out for 10 hours, 12 hours. 22 was the most. That night that I woke up and looked in the mirror, I started crying. And I said to myself, all right, you're either going to continue this and you're going to actually die, or you're going to have to change. So this was the very first night of my life where I accepted having any mental health issues. And as you know, that's normal, but also really sad. I went through all that trauma and loss at 11 and 12. I was diagnosed at 16. I was hospitalized at 17, 18, 19. And it wasn't until 22 where I reached this rock bottom moment where I was willing to accept that I had issues. The two biggest things I learned in my recovery early on was that I needed to find a way to like myself. If I didn't find a way to like myself, there was no way I was ever going to be willing to address these issues. And number two, I never chose to go through any of the trauma or diagnoses I had, but I could choose to change the coping mechanisms. So I have gone through a lot of different phases of coping throughout these past decades. I'm 44 now. Early on, the coping really was to put myself in a system where I could get control of my emotions because I had no control for a good 7 years, right? Yeah, 6, 7 years. So I stopped drinking. I woke up at the same time every day. I went to bed at the same time every night. I ate the same foods every day. I exercised at the same time. I put myself in this system of, hey, this is where I really need to be. This is what's going to benefit me. This is what helps me. And I did that for about 4 or 5 years until the system wasn't healthy, because I couldn't just be spontaneous. I couldn't just do things for fun. And so the next phase was really coming out of that system. But I was still burying a lot of things in my body. When I was 31, I joined the Peace Corps and lived in Botswana for 2.5 years. I lost 60 pounds in the Peace Corps. And everybody thought, well, maybe it's the food, maybe you're sick. I went through all the medical tests possible. And it was only after I got back to the States, about 3 years later, that I learned I was burying anxiety in my body and didn't know what to do about it. And so, I share this picture of me now, and I'm still a work in progress. This is and Big Sur, my favorite place in the world. I was just there 3 weeks ago. It is the best because it has been a process. When I was 34, I went through a divorce and decided to cope with the divorce. I was going to run a marathon, but I wasn't going to really train for the marathon. I did finish the marathon in really amazing time with my feet bleeding and my shoulder blade so sore that I couldn't move it. And that's when I realized that, like, not only was I burying emotions in my body, but I was also trying to muscle through everything. I spent the next like 4 or 5 years really focusing on yoga and trying to release emotions from my body. And then I've spent the last kind of 2 or 3 years doing breath work, like intense breath work, 21-minute breath work sessions, going back in time to hug my inner child, really trying to find ways to be more present and enjoy life. And now I sit here after going through my second divorce and realizing that awareness and growth in our lives is a continual process. It's something that we can never take for granted. I never like to give these mental health presentations and say, like, look at me now, my mental health is perfect. I'm still just a work in progress. All of you watching this are just a work in progress. And the more you learn about yourself and the more you invest in yourself, I think the bigger amount of change you can see and the differences you can make. But we're not perfect. You know, we all have setbacks. We all have things we're continuous learning. I can say that I think this kind of second divorce for me was probably the healthiest thing I'd done, because all of my relationships have just been trauma loops. They've just been me looping back into trauma, connecting over trauma, and not really growing or understanding myself. So as I look at my strengths and weaknesses again, and I look at the weaknesses, I can see how my adolescent development and my experiences impacted all of these weaknesses. I frequently disconnected emotionally because I had to survive. I didn't have parents who talked about feelings or understood them. I didn't take time to relax or recharge because I was in a constant fight or flight survival mode, trying to figure out what to do next. I struggled to live in the moment because the moments were really terrible and I didn't want to stay connected to them. And I overlooked smaller emotions necessary for growth because that's what I really needed to do to just move on to the next topic, to be distracted. I can say that I've worked on these weaknesses a lot more, especially in the last 2 years, than I ever have. But again, we are that work in progress. And really what this all comes down to is, how do we cope? What are our coping mechanisms? None of you watching this, none of the people you ever deal with in your life are ever going to choose to have mental health disorders or choose to go through severe trauma. But we can choose to change the way we cope with it. This is a synapse. You're familiar with what synapses are in brains. The thing that I really like to teach to young people and to audiences when I speak is that the more often you use a neural pathway, the more automatic your behaviors become. So if we look at the world's top athletes or musicians, these are people who have practiced something over and over and over again to the point where they no longer have to think about it. And we do that all the time as humans. The longer we do something, the better we get at it. Whether it's walking or driving or playing an instrument or playing a sport or, you know, cooking, creating a hobby that we really love. The downside of that is it's also applicable to coping. I started binge drinking when I was 16, and I binge drank for every emotional trigger I had from 16 to 22. The longer you use a coping mechanism, the more automatic it becomes in your brain. The deeper the neural pathways get, the harder it is to change them. And I think the neuroscience piece of mental health is something that people really enjoy learning about. It's something that people really gravitate to because it gives them something tangible to hold on to and to look at. If people do have coping mechanisms they want to change, there are steps. The first step is you have to want to. As all of you know, as professionals, you can't make someone change a coping mechanism. I think moving past that, though, you have to have the self-awareness to identify that coping mechanism when you're doing it. So like, it was one thing for me to be like, hey, I want to stop binge drinking. It was a completely different level of awareness to say, oh, this is when I binge drink. I need to do something different. You can replace the ineffective coping mechanism with something that is effective, but then you have to practice it. And you have to practice that effective coping mechanism until You become like the Serena Williams of that coping mechanism. It takes a lot of time. And then the last step is having an environment that allows you to change and celebrating those small wins. I think that when you're in the depths of these problems, like when I was coming out of the immense self-hatred, celebrating the small wins is the only thing that really helps you move forward. Not hating yourself for 24 hours a day, 7 days a week. Seeing that small change, seeing that small improvement is what can give people hope. And even if that environment that allows them to change is just one person, a partner, a friend, a family member, it's enough to validate their experience and help them feel seen, help them feel heard. So throughout this presentation today, I shared a lot with you. I shared a lot about how the brain is plastic. I shared a lot of my personal experience. I want to share one more story with you that is really relevant, especially to the work that you're doing. When I got out of the psychiatric ward in my senior year of high school and went back to my high school, as I mentioned, everyone just started treating me differently. So I went from being the cool guy, the guy everyone liked, everyone loved, everyone knew, to all of a sudden people just literally calling me a psycho and a crazy kid. I lost friends. I had rumors about me all around my high school. I had parents in that small town spreading rumors about me that weren't true, telling their kids not to hang out with me. And so I had a teacher who thought it would be a really good idea to bring a psychologist in to the classroom to talk about patients he treated. And when the psychologist came in, he chose to talk about the most severe patients that he was seeing. And as he did that, every student in the classroom started laughing. Even my friends who had seen me hospitalized were laughing. At this point, I was really tired of being laughed at. And I didn't find this to be funny. And so I took my teacher out into the hallway and I said, hey, this isn't funny to me. This is my life. And people have been mistreating me for a really long time. And so he asked me, okay, well, what do you want to do about it? And I said, let me speak. Let me tell people what it's like to actually go through this. And he said, okay. So 2 weeks later, I stood up in that exact same classroom and I spoke for the very first time. And it did not go as smoothly as this. I stood behind a podium. I sweated through my clothes. I shook violently. But when I finished my presentation, nobody laughed. More importantly, I learned at a really young age that if you share your story, it opens other people to sharing their stories. So that was a really great moment, but that's not what changed my life. What changed my life was that this teacher brought me back to his classrooms for the next 5 years. In the worst of my dysfunction, he had me share with people what it was like to have bipolar disorder and what it was like to experience what I had gone through. But what that teacher really did was he looked into the eyes of a kid who hated himself and he said, I love you. He looked into the eyes of a kid who didn't believe in himself and said, I believe in you. Had that teacher not let me speak that day, there's no chance that I'm sitting here in front of you and speaking now. There's no chance that I go on to speak to 2 million people, to run the biggest mental health awareness campaigns in this country's history, to write 2 books, to start a school, to create mental health curriculum. None of that happens without a teacher believing in me when I didn't believe in myself. I don't think it's a mistake that I am now that teacher, that I now spend my days looking to the eyes of kids who don't believe in themselves and returning that favor. But I share this story with all of you because it's the role you provide every single day. It's the gift you give back to other people. It's the journey that you are allowing people to experience. And it takes a lot of strength. It takes a lot more strength to talk about these issues than it does to bury them. It takes a lot more strength to uncover these issues in new ways. All of you watching this have the power to continue to change mental health. You just need to continue to embrace that power. So today I shared with you so many different things. And one of the biggest things I shared with you is my own story. But what I always hope happens after this is that at some point in your life, when you really need to the most, you find the strength to share your story, because you have no idea where your story can take you until you tell someone. Thank you so much.
Thank you, Ross. Super informative and amazing. I mean, thank you for sharing your personal story and your family photos and using that as a way to talk about mental health in a really approachable way. I really enjoyed that. So thank you again for taking the time. If anybody does have, a couple people are piping in on the Q&A, but we do have a few minutes. So I have a little spiel. And then if folks do want to drop in a question and we have some time, I'm sure Ross would be happy to answer. Somebody did just post no questions here, just wow. So
yes. And feel free to ask questions about anything. I do run a school for students grades 6 through 12. So we have a lot of interactions with them and kind of how to teach mental health from a public health perspective. Obviously, I have my own lived experience, everything else. So feel free to ask questions.
While just for a minute, is there a best way for people to, I guess, to look you up and find you and learn more about mental health literacy and what you're doing?
Yeah, let me do that. Hold on. What happened? Oh, so hold on. So these are my social media and my websites and all that stuff. But if you really want to stay connected, you can just text my name to that number. And if you text my name to that number, you'll be added to like my newsletter and everything else we're doing. Because at UCLA, we do a mental health teacher training institute every summer where we teach other teachers how to do what we're doing at our school. And I do have a new book coming out next year. And all kinds of stuff is always happening. So I'll leave that up there in the chat. I guess the best way to get a hold of me is this.
I'll make sure this gets posted in the, this will also be posted in the session materials attached to the attendee dashboard. So if anybody here wants to come back and find that, we'll add that back to the session details in the CEGO attendee dashboard. I'll make sure that's up in the next few minutes. So, and then Ross's website, rossszabo.com. So I think that's it. We can wrap up a little early unless you have anything else you wanted to add, Ross. Thanks again for taking the time. Really appreciate it. Super enjoyable. And yeah, I think we'll wrap up. If for folks that are looking for the next session in the Media and Family Track, it's at 3:15 Eastern, so about 20 minutes from now. Called The Power of Expressing Your Lived Experience as a Journalist. We've got 2 amazing journalists. Please stick around for that if you're not in any of the CE courses. And we'll see you then. Thank you again, Ross. Really appreciate the time and having you speak to everybody. That was amazing.
Yeah, thank you. Thanks, everybody. Thanks so much for all this support. I really appreciate the love and in the chat. Thanks.
All right. Thanks, everyone.
Bye.